Introduce yourselves.
Andrea Pilloni,
Rudy Gianserra,
Professional name.
Grand Perio,
Gran Perio,
Where are you from?
Rome.
Campobasso,
Region.
The region that is famous for the city of Rome, Lazio.
Molesant.
How long have you known each other?
Many years, more than 30 years.
Many years since the 90s.
Why are you together?
We're together because we're great friends.
We're good friends.
Where did you study dentistry?
Rome, La Sapienza.
Sapienza and Tor Vergata,
Where did you study periodontics?
Philadelphia, University of Pennsylvania.
University of California, Los Angeles.
Which one is better, Los Angeles or Philadelphia?
Definitely Philadelphia, the first school in periodontology, 1955.
Philadelphia is more famous, but UCLA is in the center of Beverly Hills.
Best memory of Phillies?
The colors in the fall.
Worst memory of Phillies?
The wind in the winter.
Best memory of LA?
Lots of sunshine, 300 days a year.
Worst memory of LA?
Too much driving.
What is the compliment you like receiving the most?
To be considered an optimistic person.
When patients understand what we put into their diagnosis and treatment.
Are you a couple in real life?
We're good friends.
We're great friends.
Passions?
Wine.
The soccer team of Rome, AS Roma, and definitely drumming.
Do you work out?
I do jog
I work out when my belly tells me to work out.
Best song?
my way, Frank Sinatra.
All the songs from Burt Bacharach.
The ideal
It's the
patient?
patient that understands the importance of prevention and treatment and the passion that we put with them.
The patient that transfers completely him or herself into our hands.
How many teeth do you extract per year?
Very few, not even 30.
Very few.
What about periodontics?
Periodontic is the base of dentistry.
Periodontics is the central part of oral care and has to be considered the coaching for dentistry.
And periodontitis, do many people suffer from it?
Unfortunately, yes, it's a very common disease.
Unfortunately, 50% of the adult population suffers from periodontal disease.
Is it known by people?
Yes, but we need to do more.
Unfortunately, not well known.
Are we just talking about gums?
Of course not. With gums, there is a patient with all the problem.
When we talk about gums, we talk about the patient with the compliance and lifestyle. So many things together with gums.
Is treatment effective?
Very much
Very
effective.
In Italy?
In Italy, we have great opinion leaders, great scientists. Most of the last decades of literature has an Italian signature.
In Italy, we are the forehead. We have great professionals and great scientific society.
What about implant dentistry?
Implant dentistry is important, is a very good tool.
It's a very important topic in dentistry, but not mandatory.
Is an implant forever?
An implant is for many years as long as gums are well treated and healthy.
Of course not, but if we use the periodontology mentality, it can last very long time.
Is there an implant disease?
Of course
there
there
is.
is. Very
Difficult to treat.
Floss or proxy brush?
Proxy brush,
Or
Proxy brush.
at least one of the two.
what do you expect from the future?
I expect that patients, our friends, do place at the center of oral care periodontology.
I expect that most patients and also professionals understand more and more the importance of periodontics.
Have you met any of the great teachers of periodontology?
Of course I did, starting from D. Walter Cohen.
I've met many of them.
The one who left the most?
Jan Linde,
Jan Linde,
The one who left you the
Fermin
most?
Carranza Jr.,
Morton Amsterdam.
Why Grand Perio?
Ground perio because we start from the ground, from the base, which is perio, and then we can afford any treatment in dentistry. But without the base of perio, all the other treatments are really weak.
because ground perio means seedings into a ground where at the end, eventually, we harvest very good things for our patients.
What does ground perio do?
Ground perio places the patient into the central part of our diagnosis, and then prevention and treatment will be for many, many years.
Ground perio has the purpose of spreading the importance of perio through patients, population, and professionals.